Hello and welcome to Dr. VGP Talk Show. Hello and welcome to Dr. VGP's podcast. This episode of Dr. VGP's Talk Show, we are featuring a very empowered, enlightened, and a leader of organized medicine in America today. Our star guest is none other than Dr. Satheesh Kathula from Dayton, Ohio. He is the president of the American Association of Physicians of India, one of the largest organized medicine groups in America today, which represents over 150,000 physicians and been in existence for the last 43 years. Meet the 43rd president of AAPI USA, Dr. Satheesh Kathula, an oncologist and hematologist from Dayton, Ohio, who is today rebuilding the credibility of AAPI and crusading for the immigrant physician. In his own words, today, the AAPI is a celebration of success, of hard work, where this dynamic president is conquering every challenge and triumphing. Hello and welcome to Dr. VGP's podcast. In this episode of Dr. VGP Talk Show, we bring to you a flamboyant young physician, energetic from Dayton, Ohio. Ohio, the state of our Vice President J.D. Vance, the state where Vivek Ramasamy, who we featured in the last episode, is running, or I should say gunning, for the governor of the state of Ohio. Here today we have the medical prince of Ohio, Dr. Satheesh Kathula with us. Thank you so much, Dr. Kathula, for joining us at the Dr. VGP Talk Show today. And you know, Dr. Kathula is no ordinary physician. He's the president of the American Association of Physicians of India, which is fondly known as AAPI USA, which has about how many thousand members, sir?
We have 15,000 members, actually, but we represent about 100,000 Indian doctors. And if you include the young physicians, second generation, we actually represent about 125,000 doctors in this country.
So here you're going to listen in this episode to Dr. Satheesh Kathula, who hails from Vijayawada, who had his MBBS and MD degree from Siddharth Medical College in Vijayawada, which is today in the state of Andhra Pradesh in India. And then he is today the president of the second largest organized medicine body in the whole of United States after American Medical Association. AAPI represents over 125,000 physicians, and it's one of the most active national organizations across America. Dr. Kathula, thank you so much for being with us today in your busy schedule. Tell us about your early childhood. How was it growing up in Vijayawada, your school, your parents?
Sure. Actually, I'm from Warangal area, which is close to Hyderabad, about 2.5, 3 hours from Hyderabad. And from Warangal, my town, which is a small town called Mulugu, which was a taluka headquarters, that's where I was born and brought up until I was 17. And after that, I went to Vijayawada for medical school. And when I was growing up, the small town did not have much amenities. And my beginnings were very humble. My dad was a small business person, mom was a housewife, but they always instilled that education is very, very important to move up in life. And with their encouragement, with their support, I wanted to do medicine because, you know, we used to have a lot of physicians who are my father's friends, and I got inspired by them and how much you can do as a physician. You can help people directly and save lives. And that's what inspired me to go into medical field. And then after writing the entrance exam, I got a seat in Vijayawada Siddhartha Medical College, where I spent about 5 years. And that really helped me because Vijayawada is a much bigger town, much more, diverse than where I came from. There were a lot of people who, were there from United States, in fact, as NRIs and different countries too, non-resident Indian students in those days. And that also really inspired me to think about America. Even though I'm from a small place, because, going to Siddhartha Medical College actually opened my eyes. Just not India. Doctors have no borders. You can go anywhere in the world and practice.
So the little boy from Mulugu, as you heard his story, which is a little town of Warangal. Warangal, all of you are familiar, is today in part of Telangana state. And then he went to Siddharth College in Vijayawada. Yes. Dr. Satheesh, tell us, how was your innings in America?
It was quite interesting. I came here in 1994. I landed in Chicago, right in the city. It was a windy, wintry day during Thanksgiving time. And I was really taken aback with the infrastructure and everything. It was so beautiful to see. Everything was so calm, quiet, as opposed to the cities in India. It was quite shocking to me just looking at it, live. I've seen it in movies, I've read it in novels and things like that, but looking with my own eyes in person was a great experience. And I thought I knew everything when I came to this country, but when I started really, my first innings as a researcher at UIC, University of Illinois, Chicago, it was quite challenging to really learn new system, new culture. It's, much more challenging than what I thought. So I did research for a year and a half in pulmonology. There was a dean there at that time. His name was Dr. Shraf Nagel, who was a very good mentor, We published a paper in those days, and that's my beginning in Chicago. And it was a big thing for me coming from a small town, but I had good support with friends and family, and that really made me so comfortable to really move up into residence and fellowship.
Right now, AAPI has been, you can look at me, AAPI has been in the news for all the wrong reasons, if you know, for the last 1 year. It's not during your presidency, but the previous presidency. And AAPI, once upon a time, used to be looked up to as an organized medicine, one of the best organizations. Yes. The annual conventions, we had the top stars. You used to draw 15,000 people. Yes. We had President Clinton when you had AAPI convention in Chicago organizing.
I was there for that.
That day must have been you arrived at that time.
Absolutely. That was my first medical conference ever.
In US.
In US.
Okay.
And I saw Bill Clinton.
Correct. And I think Dr. Satya Ahuja was the president at that time.
I think Gopal Lal Malani
was the president. Okay.
And it was a very wonderful experience, and that is one of the reasons why I joined AAPI.
Okay, great. Now, you know, we don't want to talk about the past, but my pointed question, what have you done as the president? I know you've been, it's 6 months now, 5 months you took
About
charge?
9 months, yeah.
When did you take?
I took charge in July.
Oh, July of last year.
But you know,
it was a pity that you were not even allowed to enter. I was told the last convention in New York, which was addressed by Dr. Oz, who's now the current administrator of CMS. You, as the president-elect, was not even allowed to enter the AAPI convention. How arrogant could the past president be?
Well, I don't want to dwell into that, but definitely it was not nice. It was very hurtful. It was very defaming, and I had every right to be there as the president-elect, winning 4 elections and winning all of them. And nobody in the history of AAPI actually won that many elections. And I did. And I was not even allowed to enter the premises, which was very sad.
I know. So now how are you making up in the last 9 months to restore that name of AAPI, which was dragged in the mud? Now, what have you have done? List out to our viewers the points you've done in the last 9 months, one by one.
Absolutely. So the week actually started from the pieces. We are trying to put those pieces which was broken down. And now we
How old? Today is 42 years old?
43 years old, actually.
43-year-old organization. Go ahead, Chief.
In a basement of an AAPI doctor in Michigan. It has grown into a big organization now. But whatever happened last year was really damaging to AAPI's reputation. So we are trying to put all the pieces together. And we are focusing this year on the communication, focusing on education, focusing on legislation, encouraging younger generation, all these things that we are focusing on. We have done quite a few things this year. We have participated in India Day parades, which is very important to be in the mainstream society and to take AAPI's name out there. And we did a big global health summit in New Delhi in October, and it was attended by hundreds of people. And we partnered with GAMES, which is Global Association of Indian Medical Students, and they presented 70 papers. We got 150 poster presentations, and we selected 70. There were hundreds of medical students from Nepal and other countries, Sri Lanka, India. So we did that. We did some workshops. We did mentorship programs, and we met Mr. J.P. Nadda, who is the health minister, and we started promoting family practice in India, because it is very important to have good primary care doctors in India, because everybody who does MD, they're going into specialties, and we don't have any good primary care doctors left to take care of people in India. So that's why we talked to Niti Aayog members, Dr. V.K. Paul, who is a very influential guy. He's an advisor to the Prime Minister Modi and Health Ministry. And we talked to the Health Minister himself. And also we talked about the violence against Indian doctors. All these things we have done in October. And encouraged by that, we have done 2 more conferences in India. Usually we do 1 or none every year. But this year we have done 3 conferences, which were all big scale.
Now, coming closer to home, Dr. Kathula, the AAPI, with the current changes, what's going on in the current President Trump's administration, do you think that Affordable Health Care Act was a boon to physicians or not?
Well, it was born to a lot of patients, but physicians, there are mixed feelings. Some people
Correct. I
like
think,
that, some people don't.
Yeah.
But I don't want to get into that right now. But definitely, the medical reimbursements are going down for physicians, and we are organizing.
We hear a lot of role of managed care organizations.
Right.
You heard the United Health CEO was shot in New York because these managed care organizations are stalling on processing your reimbursements.
Absolutely.
And trying to cut it. So what's your view on that? What are you as an organization, AAPI, doing are you breaking barriers and dialogues with the MCOs?
Yes, we are trying to do that. That's a little bit more involved. We need lobbies and things like that. But what we are trying to do is to organize a legislative day, which we have it on May 8th. And we're going to address a lot of issues like Medicare reimbursements, also pre-authorizations, which are really painful for practices. And they have to spend a lot of money. And patient care is getting delayed with that. And also, we want to talk to them about fast-tracking green cards for H-1 visa holders, because there are thousands of doctors who are on H-1 visa holders. And all these things we want to, and how to address physician shortage. We have a lot of APPs like NPs and PAs, but the quality of care is going down, healthcare costs are going up, and how can we really increase the physician force in this country? How can we address the physician shortage by increasing residency spots, and also by letting immigrant physicians to actually take up the jobs here?
I mean, you've addressed all these things now. Current administration, we have the Secretary of Health and Human Services, Robert Kennedy Jr., his views on vaccination. You have the DOGE, the Organization for Government Efficiency. They are cutting down on positions in Department of Health and Human Services. They are cutting down on different levels and scaling down healthcare. So how are you and your organization, what are you doing in preparation to make up the challenges which are going on today? Do you first and foremost feel it's a challenge, or are you posed to work side by side along with the current regime to deliver healthcare to your best in the circumstances?
It is both, actually. It's a challenge, number one, because if we are cutting down the healthcare administrators and things like that, it may pose some delays and things like that for patients, like Medicare reimbursements may be delayed and patient care may get affected with that. But can we work with them? Absolutely. We are willing to work with them as long as it is reasonable, as long as it is good for healthcare and patients. So it is both, I would say.
Now, you heard that the budget which is being discussed, I mean, there's a temporary pause in the House and going to Senate, an $880 million cut in public aid. Now, what's your opinion? What's your view on that?
Well, it becomes political, but I think there has to be incentive for people to work. I am more of an independent person. I look at things on both sides. Cutting that may affect some people, but also at some point we have to give incentive for people to work. So, America is a country where, people who are hardworking are rewarded. So I think not being political, I understand there are some people who cannot work at all. We should support them, but people who are getting benefits, I think it's a good idea to incentivize to work and show them the work when you're cutting all these aids. So I think it's a good idea to really balance those things rather than cutting the whole thing or just giving free handouts. I mean, I'm not for free handouts either. So we have to balance those two things. That's my opinion.
Yeah, you very well said, Dr. Kathula. Now, coming along, we hear a little bit about your specialty, your hematology and oncology. What made you select that? And could you talk to our viewers, what does a hematologist do now? And how does it go side by side with an oncologist?
Absolutely. That's an easy question. Hematology is...
Because that's what you do every day.
Yeah, exactly. So, hematology is blood disorders, study of blood disorders. Oncology is study of cancers. So, hematology takes care of anemia, which is low blood count, red blood cell count, thrombocytopenia, which is low platelet count, hypercoagulable state, blood clots, bleeding issues, and those things. And oncology, we take care of all the cancers like breast cancer, lung, colon, and prostate cancer, all these things. So how do they relate to each other? Basically, whenever we have oncology problem, we give chemo, their counts go down. They bleed sometimes. So how do we take care of that? If you have the knowledge in hematology, we can take care of those patients. Also, at the same token, hematology patients, there are malignancies which affect the blood and blood cells. So for such as lymphomas, leukemias, acute and chronic. So those are also oncology subjects. So we are kind of overlapping. The hematology and oncology overlap about 25% of the time. So that's why the both specialties are combined. That's why we have both of them together, which is about a 3-year fellowship. And sometimes people do just oncology for 2 years or hematology for 2 years. But in community, if you really want to be successful, people have to do both for 3 years, which is what I did 23 years ago.
Yeah, wonderful. I mean, what inspired you with, you're such a expert clinician with such excellent background in clinics. What made you, inspired you to take on the leadership of AAPI?
So AAPI is something that it's a physician organization. It's actually Indian Physician Organization in America. So this organization brings 3 types of people. Number one, they're all doctors. They're all practicing in this great country of USA. And then they are from India. So that actually, those are the 3 things which bring them together. As I mentioned earlier, the first ever medical conference I attended in the US was AAPI, 1995. I was not even a resident. I was working at UIC as a research assistant and an observer there in clinics. And that's when one of my uncles said, hey, let's go to this AAPI conference where you see a bunch of Indian doctors, you can network, you can get into residencies. And by the way, President Clinton is coming. So that excited me, and he took me and he paid my registration at that time. And we both went, and I saw all these doctors in suits and tuxedos, and Bill Clinton, of all the people, the sitting president was there, which was truly inspiring. I said, you know, if I have to be associated with some organization, this is it. So that's when I actually became the regional director. After that, I ran for elections. I was the local president, local chapter president for Indian doctors in Miami Valley, which is Dayton, Ohio. And then I was the state president. Then I was the regional director, then board of trustees, then treasurer, secretary, vice president, president-elect. And now I'm the president after 15 years of my work in AAPI. So what inspires me? You're working with very intelligent people who are compassionate, who are actually saving lives. And it is a privilege and honor to serve these doctors who are really working hard. And they dedicate their lives. Some people are on call 24/7. And they really dedicate their lives to this profession. So that's why I thought this is a wonderful organization. And for little things, I am actually very grateful for whatever I am today, and to serve the 15,000 dues-paying members and represent 125,000 doctors in this country of Indian origin.
And you know, Dr. Kathula, as you just heard him saying with passion, he also wears a beautiful AAPI tie. The first time I'm seeing an AAPI tie, I've been 42 years in this country, as old as AAPI is, in 43rd year. And now tell all our listeners about the exciting 43rd annual convention, which you are curating together in Ohio. Give them the dates and tell them all what's going to happen.
Absolutely. Then. So I'm really glad to talk about that. So I've been to many conventions. Convention should be a celebration of success, correct, not a success by itself. So what we have done this year, we need to celebrate during convention. So a lot of people really sweat about that convention itself, but that's not the thing. That is the finale of anybody's presidency or legacy, what we have done the whole year. So what we have done this year, we have done mentorship programs, we have done the legislative day, which we're going to do very soon, and we have done governing bodies, we have done a lot of other mentorship programs, and these global health summits in India.
Who's the star entertainer?
Well, we are talking to some people. For example, Aditya Narayan is probably most likely.
Udit's son?
Udit's son. He was a very good entertainer. So, and the thing is, there is a balance between the entertainment and the expense. This is a non-profit organization, voluntary organization. We don't want to spend millions of dollars on a convention. We want to keep the budget low, and then whatever money is left, it goes back to AAPI. So entertainment for 2 hours, we don't want to spend $500,000. We can get, I'm into music. I know a lot of people, and I like a lot of singers like Sonu Nigam, Arijit Singh, Hariharan, but we have to keep the cost down. So Aditya Narayan kind of, strikes that balance. And we are going to have a lot of CMEs, a lot of symposiums, like we have medical licensing symposium, medical education symposium, political symposium, CEO forum, women's forum, along with CME meetings, entertainment, yoga, meditation, a lot of networking opportunities. For medical students and residents, we have poster presentations. For YPS, we have singles mixer, and then we have other things separate for young physicians so that they can network. If they're looking for a job, they're looking for any further studies like fellowship, it'll be useful for them. So we are trying to bring about 1,000 physicians in one platform, and then we are inviting American Medical Association incoming president, Dr. Bobby Mukamala, who graciously agreed. He'll be one of the keynote speakers. And we also have Mario Capecci, who is a Nobel Prize winner in science and medicine from Utah. He's coming. He confirmed his presence. And then we have Dr. George Abraham, who is the chair of Federation of State Medical Boards. And we have Michael Sok, who is the chairman of Board of Trustees for American Medical Association. So all these bigwigs will be there, and they are inspirational speakers, by the way. They are not only very successful, they're not only physician leaders, but they are excellent speakers. And I invite all of AAPI members to come there and have these things, witness these things.
You just heard Dr. Satheesh Kathula talk about the 43rd upcoming annual convention of AAPI taking place on July 24th to 27. And in his own words, he described it as a celebration of success, a place where you can meet people, collaborate, network, and conquer your dreams. Dr. Kathula, today you're living your dreams. You landed in 1995, attended the first convention,
right,
and today you're the president of the organization and you're conducting your own celebration of success. Yeah. You also alluded earlier that you love music and you're a great fan of all the artists. Could you, for our viewers, sing a short song? Would I say you like to sing Mukesh's song, Kishore Kumarji's songs? Whose songs would you?
Well, I love both of them. I love a lot of other singers too, but I'm a fan of Kishore Kumar. I became a singer just listening to Kishore.
Please delight our viewers with one verse. Tell them the name of the song, the meaning of the song, and the movie if you can recall. We would love to have that with you today. He's a multifaceted. You're seeing a different dimension of Dr. Satheesh Kathula, the successful, celebrated 43rd president of the American Association of Physicians from India.
Thank you. Chalte, chalte, मेरे ये गीत याद रखना, कभी अलविदा ना कहना, कभी अलविदा ना कहना, रोते हंसते बस यूं ही तुम गुनगुनाते रहना, कभी अलविदा ना कहना, कभी अलविदा ना कहना.
Wow. Sir, I put you on the spot and you just carried away. Chalte, chalte.
I love it. I love singing with other people like it or not, I don't know.
No, it is fabulous. It's fabulous. You're such a success. I think you can define success by your life's journey. Now, if you're given an opportunity to take 3 people out for dinner from the past or the present, who would those 3 people be?
So, from the past, you're talking about everybody or
give our viewers, what is Satheesh Kathula to who your mentors, who your heroes, who you value? You're given choice, 3 people. They could be past, dead and gone. They could be present, living. Just to give our viewers a feel, who would you like to take out for dinner? It could be Vaijantimala. I don't know. I'm just telling you. Just any 3 people.
So, the inspirational people in my life, my teachers, actually. Right. So, Dr. Prasanna Kumar, who was a surgeon, and he was such a great teacher, and he would explain you until you understand. I mean, that's what, I got my teaching skills from. I'm a clinical professor of medicine, and I love to teach my students, residents, I mentor several people. So he was my inspiration in those days when I was going to medical school. And then, coming to movie world, Amitabh Bachchan, I had an opportunity to meet him. He's such a, well-versed guy, well-spoken, great actor, wonderful human being. And he's like, when he comes into the room, you get that aura. I mean, I learned a lot from his life. And then Barack Obama, who actually started from very humble beginnings, and he became the president of US, and he was there for 8 years. while I don't agree with all what he has done, but as a person, the diction with his speaks, and he was, I think, one of the best speakers I came across, and he's one of my inspirations.
You just heard Dr. Satheesh Kathula say the three people he would like to take out for dinner. One is his professor, surgeon Dr. Prasanna Kumar. Is he still alive?
Yes, he is.
Wonderful. Sir, you have been talked about, and hope all our viewers would know. Is he in Vijayawada?
In Vijayawada.
Vijay, great. Second is Amitabh Bachchan, who needs no introduction. And third is Obama. And he very eloquently said he likes Obama's eloquent oratorical skills. He may not agree with his views. Now, sir, if you were to write, I know you've written a book and you're going to launch it next month. But if you're to write an autobiography, what would the title of that book be?
Be passionate, be optimistic, and be successful.
Great. So you just heard Dr. Satheesh Kathula talk. If he ever writes an autobiography, it'll be passionate, be successful. Now, you've written a book which you're going to release next month. Tell us all about it, the name, and what can people look forward to read while they flip the pages.
Yes. So I've been thinking about this project for the last 10 years or so, because I'm an immigrant doctor and I'm successful in this country, and I'm thankful for that. And there are a lot of people who came like me. It is not a bed of roses as people think. Everybody, looks at us, the patients and the administrators here, and they think that, hey, we are rich and we have these, good homes and cars and things like that. But nobody really knows what are the struggles behind it. So a lot of physicians who come here actually go through a lot of, challenges. Like, for example, they have to leave their family, they have to prepare for different exams. Even though they have done their post-graduation back home, they have to take the USMLE again, they have to go through the training, they have to, apply for different programs, and, they have to really be successful in their practices. And then in the mean process, they go through a lot of stuff. Sometimes there are undertones, there are sometimes, the real discrimination. And, when you're going up, you may not, feel that encouragement, by the people who are around you. But mostly it is really good. So a lot of patients ask me, hey, doc, where are you from? What kind of language you speak? And where did you go to your medical school? Are you a U.S. citizen? I mean, all of these, most of the patients are super nice, especially in oncology world. And they ask me like a friend, like a family member, because I know some of them for 15 to 20 years. I wrote all the stories of different doctors from various parts of the world. Actually, what is their perspective? Why they came here? How they came here? What kind of visa they came in, and what are the struggles they have. So how can we positively contribute to this healthcare system? Actually, the contribution of foreign doctors or international medical graduates, what we call, is tremendous. It is really significant in every field, in innovation, in research, in clinical practice. The doctors from different countries contributed to this healthcare tremendously.
What is your book called, sir? I mean, it seems to be a very interesting, enlightening, empowering book for all physicians. And yes. What's it called?
The title of the book is Immigrant Doctors Chasing the Big American Dream.
Wow, how apt it is. Immigrant doctors chasing the big American dream.
Right.
I mean, it's going to be, looks like we're all looking forward to the book launch.
Thank you.
And it's going to be a very interesting book. And I'm sure all of you all, when you get a chance, go to the bookstores and see if you can get the book by Dr. Satheesh Kathula, which says Immigrant Doctors Chasing the Big American Dream.
Yes.
On that note, if you're given 3 words to describe yourself, Dr. Kathula, what would those 3 words or adjectives be?
Yes. Optimism.
Optimism, great.
Ambition.
Ambitious.
Success.
Success. You just heard Dr. Satheesh Kathula describing himself in 3 words: optimistic, ambitious, and successful. It's so
service too.
And service oriented. Great. So it's wonderful having you. And in the last 30 minutes, we dwelt deep into hearing about Dr. Satheesh Kathula, his contributions to organized medicine in America, his talents as a singer. Kabhi Kabhi, beautiful song. He brought back Kishore Kumar alive today on our show. Chalte. And also, he also did talk about his earlier days in Vijayawada, in Warangal, and his medical school. and what all he is doing currently as the president of the American Association of Physicians of India. I think his big part of his legacy he wants to leave behind. He wants America to be a successful place for immigrant physicians. According to Dr. Kathula, there's a shortage of physicians today, and he is still fighting, still to meet the challenges of empowering the physician in general and in particular the immigrant physicians. I think today, with all what's going on, talking or terming them as foreign doctors or foreign medical graduates will put us totally out of place. We won't be in order with the current regime, but we'll say physicians.
Yes. And it is immigrant, international medical graduates is what we
But I think all the second generation now, all our children are becoming into physicians. And now coming to your family, how many kids do you have?
I have two boys. We're blessed with two children, wonderful kids. My older one is an anesthesiology resident in Cleveland. And then my younger one is in medical school. He's in third year.
So both are following the footsteps of the doctor.
Yes, they didn't learn
father,
from me.
The father, that's great. And in parting, sir, what would you like to tell our viewers? Generally, some advice you're going to give, not only to today's generation, the Z generation, millennium generation, but even to us.
Yeah.
You have become, today you're a successful leader. People look up to you. So it's all yours to give your concluding remarks and closing views to our viewers.
First of all, I thank you, Dr. Vijay Prabhakar, for this opportunity. As I said, my theme has been, my mantra has been, be optimistic and do some service to people, which should be part of your life. I tell my kids that, I tell whoever I come across, because God has given you whatever you have, but giving what you have is godly. So it's not like, we don't have too much to give, but people who have a lot may not be giving. But when you give something, you become rich, not by accumulating. So do service and give back to the society, which has given you so much.
Thank you so much, Dr. Satheesh Kathula.
Thank you, sir.
It's been wonderful. And I think you have imparted so much of enlightenment.
Thank you.
You have given us insights of what the new AAPI under your dynamic leadership is doing. And we wish you every success on your book launch.
Thank you.
And last question, which I think we should address now. Where do you see yourself 5 years from now?
Well, that's a good question. I haven't thought about it yet. But some people encourage me to go into mainstream politics and things like that. But I'm not sure. But I want to build a cancer hospital back in India where there is huge need, charity hospital. That's my next project, actually. So that's what I'm going to be working on.
Wonderful.
I need everybody's support for that.
Great. Thank you so much.
Thank you, Dr. Prabhakar.
viewers, elevate your business to new heights and reach 35 million potential customers with Global Eye Digital. Contact us today at globaleyedigital@gmail.com or info@globaleyedigital.com. Let's take your business global.